everybody to feel that they have to follow this advice, and that's why I'm taking the steps today to set that out very clearly for people, and we will continue to reiterate and get those messages clearly to people in every way we possibly can. Yes?
Over the weekend, a consultant at the Queen Elizabeth University Hospital raised concerns about hand hygiene and infection control, and she said that her experience was in some cases supermarkets were doing better than the NHS at this. Is that a concern, and what is being done to address that?
If it's the person, I think it is, I've had a personal email exchange with that medic this morning, assuring her that the concern that has been raised will be properly looked at and followed up, and we will discuss with hospitals. I'm going to hand over to Catherine in terms of the best way in which to ensure good hand hygiene in hospitals. It's not necessarily at front doors of hospitals, it's before you enter clinical areas, but perhaps Catherine can say a little bit more. But I want to say any frontline health professional that is raising concerns with the government about different ways in which we can do more to protect them and protect the public is being properly considered and properly followed up, and I want to give that very clear assurance.
We're advising people really to have some kind of hand hygiene at transition times. So whether that's entering a building, whether entering your own home, leaving your own home, arriving in your where you're going to, and that would include hospitals. So either wash your hands with soap and water. Soap and water, very, very good. That will get rid of this virus. It has a greasy coat around it, so plain old soap will dissolve the virus and remove it completely. Soap and water not available, then hand sanitizers. But it's that arriving somewhere new and then arriving home again when you've been out, all of those transitions to, if you have touched surfaces, wash your hands and you'll get rid of the virus.
But just to repeat, the specific concern that you've raised there is being properly followed up. Yes.
Douglas Ross appeared to suggest this morning that the emergency powers you alluded to could give government the power to seal off areas if clusters emerge. Is that something you would consider?
We'll consider all steps that we think are necessary to protect public health. And I say that openly and candidly, and if we consider that powers need to be used, then we will set out to the public why we consider it necessary to use them. But I don't want to get into a situation, what we're asking people to do is for everybody's protection. And as far as possible, we shouldn't have to be in a situation where statutory powers are being used to force people to do the right thing. People should be doing the right thing because it is for their protection and the protection of their loved ones. And in my experience, some of it anecdotal, some of it more formal than that, the vast majority of people are doing the right thing, and I would encourage and appeal to the public to follow the advice that is being given. Any other questions? Jean, do you want to just say a word or two about ongoing plans to scale up NHS capacity?
Sure. So I think last time I spoke at the briefing, I spoke about the mobilisation plans across our health and social care service. Those are well in hand. That is to do two things in particular. First of all, to double the number of intensive care beds that we have and to increase our bed capacity by 3,000. We now have all the individual board mobilisation plans with us, and we're going through those line by line to make sure that individual boards are doing everything that we believe they can do to maximise the capacity in the hospital setting. At the same time, I've met with community pharmacy colleagues to ensure that they have what they need, and they are looking at extending their hours for many areas of healthcare. Of course, they can deliver that. We've now extended the work that was underway in Inverclyde across Scotland so that community pharmacies have access to health data that they need. And this is all designed to ensure that healthcare continues to be provided, but that we take some of the additional pressure off our GPs and practices so that they can continue to do the work that they need to do as well. And there will be more steps taken in that way that we can give you detail about in the coming days.
Okay, final questions. Alan.
On they're able to get the paramedics back into the workforce. How successful has that been so far? Where are you in terms of numbers?
So I can't give you the final numbers as of today, but what I can tell you was that within 24 hours, we'd had 300 contacts from people either by telephone or by email offering. They were in the categories that we needed in terms of medics and nurses and some AHPs, some of our retired physios and occupational therapists, who of course will be very important in the community. So within 24 hours, we'd had 300 contacts from people coming forward and saying, we will help with this. We'll be able to give the up-to-date numbers at the start of the week and be clear on the process that people go through in order to offer us that really valuable help.
The offers of help that are flooding in from people right across the country, from people, health professionals, but from people with a whole range of different skills and expertise that want to contribute, that is phenomenal. And I really do want to place on record my thanks. And everybody's offer of help in due course will be looked at. And if that can contribute to the effort, then we will absolutely take people up on these offers. Right, finally, Sev.
Just you said that the original view was that an infected person was infecting between 2 to 3 other people. What's the new ratio?
It's more than that. Maybe 4 people, maybe 5, maybe 6.
Right. Between 4 and 6?
Yeah.
Lastly, yeah.
In NHS in England, I think I've written to 1.5 million vulnerable people to instruct them they are seen as being at risk. Is there a similar idea?
That's what I talked about in terms of shielding. When I made the comments, I referred to the number 200,000. So that is the equivalent of the 1.5 million. They will, over the next period, be written to with the specific advice about what they should be doing, but also the support package, because these are people that we're going to be asking to strictly isolate. So there is a need to make sure that services, food, medicine, essential supplies can be got to them. So that is the equivalent of what you have heard over the weekend from NHS England.
And is that a warning in the first instance that you're risking your health if you don't stay at home?
Look, if you recall, over the past few days, we've been talking about this group. So this is the group who we describe as having underlying health conditions that get the flu vaccine are already being given the social distancing advice. This is a group of people who are particularly vulnerable. I'll ask the Chief Medical Officer to talk about some of the conditions, and that the advice to them is to much more isolate, and that will be pretty strict isolation. But Catherine, do you want to say a bit more about that?
So this is a group who have immunocompromise. They will already know that they're in these groups because they're either receiving treatment such as cancer treatment, which depresses their immune system, or they have had, for example, an organ transplant, a kidney transplant, so they take medication to suppress their immune system. Those are a smaller number than the wider flu vaccine group, but they will be written to individually, not only to let them know, although as I say, they already are aware and are advised during, for example, cancer treatment, not to go to social gatherings, not to put themselves at risk of any infection. And we will be spelling out exactly what each of those groups, those measures need to be. They are, though, going to be recommended to self-isolate, to stay away from other people completely for 3 months.
Yeah. Okay, can I thank you all for coming this afternoon, and obviously we'll do a further briefing tomorrow, and we'll see you then. Okay.